Over the past several months, the personnel of MCFRS have responded to the COVID-19 challenges with a tremendous amount of resilience and understanding as we change the rules on literally a daily basis. Despite the need for cumbersome protective equipment and at increased personal risk, our members continue to serve the residents and visitors of Montgomery County with integrity, respect, impartiality, and excellence. On behalf of Dr. Stone, Assistant Chief Alan Bush, and Division Chief John Kinsley, I'm proud to honor the MCFRS clinicians who have faced these challenges and exemplified the guiding principles of our county executive and fire chief. In lieu of COVID, we've modified our traditional EMS Clinician Award ceremony and restricted these presentations to small group events at fire stations. On Tuesday, June 16th, 2020, units from stations 32 and 3 were dispatched to an office building for a patient in cardiac arrest. On arrival, the crew from Paramedic Engine 732, Ambulance 732, and Medic 703 were directed to an office where they found Rockville City Police Department already on the scene performing CPR on the patient. Co-workers stated that the patient was participating in a Zoom meeting when they noted the patient passed out. Concerned for the patient, the co-workers started to search for him and found him in his office. The patient was pulseless and apneic, and the co-workers immediately started CPR and called 911. Police officers from Rockville City arrived quickly to the scene and took over CPR compressions until the arrival of EMS. The initial rhythm was ventricular tachycardia, and the crews delivered a shock at 200 joules. The rhythm converted to ventricular fibrillation. The patient was shocked a second time. While CPR continued, crews established IV access, IO access, intubated the patient, and administered epinephrine. One additional shock was delivered, and amiodarone was administered. During the resuscitation attempt, the patient displayed a spike in the end-tidal carbon dioxide level, suggesting a return of spontaneous circulation. And during the next pulse check, the patient had a strong carotid pulse and a palpable blood pressure. The patient had a return of spontaneous circulation within 33 minutes. Crews performed a 12-lead EKG, and the patient was found to be bradycardic with a second-degree type 2 heart block. Due to the bradycardia, a decision was made by the crew to pace the patient and begin neuroprotective hypothermia. The crew transmitted the EKG and consulted with Shady Grove Adventist Hospital, and upon arrival at Shady Grove, the patient was determined stable enough to be transferred to the cath lab, where he was found to have 100% occluded right coronary artery. The patient was admitted to ICU at Shady Grove, where he unfortunately passed about 1 week later. Thanks to the co-workers who recognized the patient was experiencing a medical emergency and immediately initiated CPR, the police officers who arrived on the scene and continued the resuscitation efforts, and the coordinated actions of MCFRS crews, the patient was given every opportunity for survival. So with us today are Rockville City Police Corporal Carl Platt and Officer Joseph Fetter. And in addition, we have firefighter Giovanni Taylor, firefighter Matt Santucci, firefighter David Reed, and Master Firefighter Argy Kopke. You guys come up and accept an award. Thank you very much. On Tuesday, January 21st, Paramedic Engine 732 was just clearing a call near Shady Grove Hospital when they were alerted to a pedestrian struck at the intersection of Shady Grove and Medical Center Way. Paramedic Engine 732 arrived on the scene in under 30 seconds to find a patient lying in the street after being struck by a vehicle. Crews quickly assessed the patient and determined that the patient was pulseless and apneic. Crews immediately initiated manual CPR and opened the patient's airway via jaw thrust due to the traumatic mechanism of injury, and assisted ventilation via vac valve mask. During the first pulse check, the patient was found to have a strong carotid pulse and spontaneous respiration, but he was still unable to maintain his own airway. Crews placed an airway adjunct and continued to assist ventilations. Crews performed a trauma assessment and found a large laceration and hematoma to the back of his head. Other units who were clearing Shady Grove Hospital also stopped to assist with patient care. Patient was packaged for transport to Suburban Hospital and appropriate notifications were made. During the transport, the patient began to maintain his own airway. The patient became much more alert and was able to open his eyes spontaneously and started to look around. Crews continued to monitor the patient's condition and transferred care to the trauma team at Suburban Hospital. The patient was intubated upon arrival at the trauma bay. The trauma team diagnosed the patient with a subdural hematoma and a pulmonary contusion, and he was monitored in the ICU. The patient received physical therapy during his stay and was released about 1 week later. Thanks to the professionalism of all the crews on the scene and the incredible team at Suburban Hospital, the patient was discharged and has made a full recovery, unheard of for a traumatic arrest. Thank you very much, guys. In the early morning hours on Thursday, December 5th, 2019, crews from stations 28 and 40 were dispatched to an OB call with a very unusual set of circumstances. On this morning, the patient felt her water break and noted that the umbilical cord was prolapsed, which is a true medical emergency. The patient was 36 weeks pregnant with twins and was scheduled for a C-section the following week. To make matters even worse, one of the twins was in a breech position. Upon arrival of the crews, they found the patient in the bathroom on her hands and knees with at least 8 inches of the cord presenting. The crews recognized the urgency of the situation and quickly loaded the patient for transport. The crew also consulted with Shady Grove Adventist Hospital. The staff at Shady Grove advised the crew to push the umbilical cord back in and keep pressure off the cord. Master Firefighter Luger maintained the position until care was transferred to the L&D staff in the operating room. The patient received an emergency C-section upon arrival to the hospital and delivered healthy twin boys. Due to the knowledge, skill, and coordinated effort of the crews, the twins were discharged home after a short stay in the NICU and officially started their lives as part of a family of 6. So I'd like to present awards to Firefighter Benjamin Darland, Firefighter James Taylor, Master Firefighter Chris Hernandez, Master Firefighter Steve Staub, Firefighter Steve Abramovich, Firefighter Brian Force, Captain Rudy Williams, Master Firefighter Tim Anderson, Firefighter Gary Kern, and Master Firefighter Luger. There's not a lot of people here, so clap for each other. Come on. Thank you guys, quick and easy. It's the crew of Medic 712. On Sunday, June 28th, Medic 712 was dispatched to Prince George's County to assist with a patient who was involved in a fireworks accident. On arrival, the crew found the patient lying in a parking lot being assessed and treated by units from PG Fire. Bystanders stated that the patient was holding fireworks in his hands when they exploded. The explosion caused the partial amputation of both thumbs, injuries to both upper extremities, and a large laceration to the head. The crew recognized the urgency of the situation and quickly packaged the patient for transport. During the transport to MedStar Hospital, the crew continued to assess the patient. It was noted that the patient had uncontrolled bleeding, so the crew applied a tourniquet to the injured extremity and were able to control the bleeding. Due to the injuries to the upper extremities, paramedic Hedges initiated an IV in the patient's right foot. Hedges administered fentanyl for the pain and administered Zofran prophylactically for vomiting and to minimize the threat of the patient's airway. The patient's airway and condition were continuously monitored and reevaluated during transport, and the crew consulted with MedStar via EMRC. Upon arrival to MedStar, the crew turned the patient care over to the trauma team. The patient was found to have a penetrating brain injury with an open depressed skull fracture. The patient received a blood transfusion and was prepped for immediate surgery. During surgery, the patient had a craniotomy to remove foreign objects and close a small area where brain matter was exposed. The patient was then transferred to the ICU to be monitored. Thanks to the knowledge, skills, and abilities of MCFRS and PG fire crews and the incredible trauma team at MedStar, the patient was given every opportunity for a full recovery. Congratulations. On Sunday, April 26th, units responded to a house in Bethesda for a patient complaining of trouble breathing. On arrival, the crews were met by the patient's wife, who stated her husband was working on the computer in the basement when he suddenly began to feel unwell. She states the patient walked up the stairs to alert her when he began having shortness of breath, prompting the call to 911. Crews found the patient alert and oriented, sitting on the couch in the living room where he stated he had just vomited and was feeling better. As the crews were performing their assessment, the patient stated he was beginning to feel very dizzy and then he lost consciousness. The patient initially had agonal, snoring respirations and a weak pulse, and then became pulseless and apneic. Crews immediately started CPR and assisted with ventilations while an EKG was performed. The patient was found to be in ventricular fibrillation and was ultimately defibrillated 4 times. After the 4th shock, the patient had a palpable pulse, spontaneous respirations, and an organized sinus rhythm on the monitor. The patient was moved to the EMS unit for transport to Suburban Hospital. Crews continued to assist patient ventilation via bag valve mask and monitor his condition. During the ongoing assessment, the patient was found to be responsive to painful stimuli and began to move his extremities. Crews performed a medical consultation and continued to reassess and reassure the patient during transport. Patient care was transferred to the staff at Suburban Hospital. While at Suburban, the staff placed an internal defibrillator pacemaker due to an arrhythmia that caused the arrest. The patient has made a full recovery and was released from the ICU 8 days later. Thanks to the knowledge, skills, and abilities of MCFRS responders and the incredible staff at Suburban, the patient was able to return home to his wife and family. The patient and his wife would like to thank the EMS crews on the scene and the staff at Suburban Hospital. I have an email from the patient's wife. On April 26th, a number of you responded quickly to a 911 call at my home. My husband Brian was in severe cardiac distress. I was made aware of the grave concern and doubts as to the outcome, but you never gave up and a precious life was saved. He is home and doing very well. Our heartfelt gratitude and prayers are with you daily. God bless you all. And we also have a video that we're going to show you guys from the patient himself.
Hello, my name is Brian Williams. I live on Hollands Drive. It is my understanding that you came answering the call from my wife that I was unconscious. I want to thank you for saving my life and transporting me to Suburban Hospital, and we are doing very well now. I have an implantable pacemaker and I feel wonderful, and the doctor says I'm wonderful too. And I appreciate everything you did.
On Monday, January 6th, Medic 714 was dispatched to a house in Poolsville for a patient reported to be experiencing chest pain. On arrival, the crew from Medic 714 found the patient walking down the stairs to meet them. The patient informed the crew that the chest pain started about 1 week ago and have not improved. The patient was also complaining of radiation down his left arm. The crew noted that the patient was also presenting with clammy skin and had a significant medical history that were risk factors for cardiac disease. The patient repeatedly told the crews that he did not wish to be transported, but would like for EMS to assess his vital signs, and he agreed to have a 12-lead EKG performed. The patient was moved to the EMS unit for further assessment and evaluation. A 12-lead EKG was performed and showed ST elevation in leads V1, V2, and V3. The crew immediately recognized the ST elevation MI and were able to convince the patient to be transported to the hospital. Paramedic Rose consulted with Shady Grove Hospital and initiated a STEMI alert and transmitted the EKG. The early recognition of the STEMI and early notification to Shady Grove are important in this case because at the time of the consult, both cath labs were in use. The staff at Shady Grove were able to prepare for the patient and were quickly able to move the patient to the cath lab for definitive treatment. The patient was diagnosed with an anterior wall MI and initially had stents placed, but would later require a triple bypass. Thanks to the assessment and care provided by the crew of Medic 714, as well as the early recognition of the STEMI and notification to Shady Grove Hospital, the patient has a positive outcome. Congratulations. On Thursday, June 4th, Montgomery County Fire Rescue Captain John Peppel and his wife, paramedic Tina Peppel, were outside enjoying the beautiful summer weather and spending some time together in Seneca Creek State Park. While hiking around Clopper Lake, they noted a young girl in the lake who appeared to be struggling to stay above the water surface. Captain Peppel and paramedic Peppel went to the edge of the lake and attempted to encourage the young girl to walk towards them, but instead, she turned and ventured into deeper water, causing her to really struggle to stay above the surface. At this time, the young girl began choking on the water and was about to go under. Captain Peppel entered the water to reach the young girl, and paramedic Peppel called 911 to request additional assistance. Captain Peppel was able to reach the young girl and pull her safely to the shore. The Peppels performed an assessment of the girl's condition and noted that she appeared to be nonverbal and alone. They decided the best course of action would be to bring her to the boat rental area where MCFRS units were staging. When the young girl became tired of walking, paramedic Peppel offered to give her a piggyback ride, which she happily accepted. Paramedic Peppel carried her for over half a mile on the rugged trail. What the Peppels did not know was a family was experiencing their worst nightmare. About an hour earlier, the family had discovered that their autistic daughter had walked away from the house and they were unable to locate her. Numerous county police officers and members of the family were desperately searching the surrounding area looking for her. The police officers searched the area and were alerted to the incident at Clopper Lake after the description provided by the Peppels matched the description of the missing girl. County police brought the family to the park to be reunited with their daughter. The selfless and heroic actions of the Peppels turned what could have been a very tragic incident into a very happy reunion. At the right place at the right time, the Peppels proved that they are never off duty. So I have a note from the family here. This is from her father. On June 5th this year, our nonverbal autistic daughter, Leslie, was able to sneak out of the backyard without anyone noticed. She went missing for over 2 hours and ended up walking about 3 miles with her scooter into Seneca Creek Park through a trail that not many people actually use. She jumped into the lake, and while struggling with the water by a complete miracle, John and Tina found her and saved her for what would have been the worst tragedy our family could have ever experienced. We have no words to thank both of them. Their humanity and commitment to their work is admirable, despite being off duty, to see our girl fighting with water and just obey their instincts and jump into the water to save her. Because there is nothing we can say that could truly express our true gratitude, in the name of Leslie's twin sister Layla and her 2 older brothers Mike and Ian and her parents Angela and myself Jose, thank you. We really wish we could have been there to show support. Sadly, these strange times force us to communicate through less personal means instead, but please reach out if there's anything we can do to help you. We are forever in debt with you. Congratulations.